Welcome back to 12T Health. I'm Dr. Derrick DeSilva. 1 in 3 Americans lives with some type of chronic pain. Medications provides only temporary relief. But for those seeking a more permanent fix, there's an FDA-approved treatment that's showing results. It's called Calmare Therapy. It's non-invasive, drug-free, and pain-free. And my next guest is one of only 5 certified providers of this treatment in the country. Here to tell us about it is Dr. Michael Cooney, a chiropractor with Rutherford Allied Medical Group. Also joining me is Laura Miller, a teacher who's been treated successfully with Calmar. Welcome to the program. Great to have you here.
Thanks for having us.
More common causes of pain, doctor? I mean, there's so many people in this country with pain. What would you see the top 2 or 3 are?
Well, right now we're dealing with a variety of conditions from CIPN to RSD to diabetic neuropathy, post-surgical trauma, any neuropathy that occurs following these conditions.
You mentioned a couple of abbreviations, some initials there. Could you just tell us what those are?
CIPN is chemotherapy-induced peripheral neuropathy, which is a result of the chemotherapy because of its high metal content.
Right.
Actually damages the nerve and causes the neuropathy.
And then the other one you mentioned?
Was reflex sympathetic dystrophy, which Laura had.
Mm-hmm. And what is that?
That's a condition that is very curious in its origin, in that it generally starts following a trauma, but the tissue where the trauma occurred is totally healed. They've done MRIs, X-rays, EMGs, all sorts of testing to determine that there is no relevant cause for the pain in that particular area.
But there's typically pain that is in that area.
Pain.
Laura, what happened to you?
Initially, I was in a car accident, and then I also had a foot surgery. And those 2 things combined started chronic pain in my life. It was a severe burning and electric pain. Felt like I was getting electrocuted or stabbed with a knife. And I was also very hypersensitive to touch. Nothing could touch my foot. I would cry just putting the sock on.
So let's get right to this. What is the Calmar therapy?
Calmar therapy is a set of algorithms that are used, that are delivered via pads that are placed outside the treatment area.
What's going on here? Tell us, just talk over this.
Okay, what is going on here is you'll see the pads that are placed on the patient, and what we're following generally is the dermatome
which is the path along which the nerve runs.
Correct.
Right.
And what we're trying to do is send a message through the pain area from no pain areas to the brain, in essence trying to disrupt what's called the somatosensory cortex, so that the brain will no longer see that area as a pain site.
What's your success rate with this?
With RSD, I would say we're at 85%. And
with reflex sympathetic dystrophy,
correct.
And what about with chemotherapy-induced?
I personally have only started doing it on chemotherapy-induced peripheral neuropathy, but Mayo, Massey Cancer Institute, a number of heavy institutions are doing recent studies with it now and are showing significant progress with it. In fact, Walter Reed is doing a phantom limb syndrome, which is, it's obvious that there's no pain there because the limb is no longer.
Laura, living with pain has got to be one of the most debilitating conditions that people can have. Before and after, tell me how your life has been affected.
Before, I wouldn't let it take over my life. I had a real desire to finish college and start my career, but it had to take over some aspect, and I really suffered just having a normal life for someone in their 20s. You know, I didn't go out with friends and just those kind of activities. Everything involved pain, and to put it simply, for years of my life, I could not go a day without screaming and crying in pain every night, and now I don't.
How long did it take how many treatments typically does it take for people to get relief from the pain?
I think it varies, but from what I understand, Dr.
How about
Cooney,
you? Talk
correct
about
me,
your condition. How long did it take
The
you?
very first treatment, I felt significant relief.
Really?
In fact, when it was finished, I just started crying because
Wow.
I forgot what it felt to feel like without pain.
Mm-hmm.
But then once I finished the course of treatments, I was completely pain-free.
Is there anybody that's not a candidate for this type of therapy, doctor?
We don't do the therapy on anybody with acute conditions. For the most part, I don't think I've seen anybody that hasn't had the pain for a minimum of a year and a half.
Really?
Many of the patients, like Laura, have been suffering from I have a woman that's starting next week that's had the pain for 15 years.
Thank you for joining us.
Thank you.
Great information. Still to